So what is platelet-rich plasma? Basically, it's a protein or component of the blood that's responsible for wound healing, amongst other things. And it's mixed in with your red blood cells, and it's all made in your bone marrow where stem cells are found. So it's a very rich component of the blood as far as skin healing is concerned. Now, how we use it, because obviously it's mixed in with the red blood cells and stuff like that, and we want to separate it, is we spin it in a centrifuge. And I'm not a physics expert, but the different densities kind of separate, and then you're left with the lighter platelet-rich plasma at the top, and your red blood cells kind of sink at the bottom because they're heavier. And then we take that platelet-rich plasma, and that's where all the fun begins. So platelet-rich plasma has a lot of medicinal purposes, but today I'm going to be talking about the cosmetics and how it's used in our practice. So basically, it can either be microneedled or injected into the skin, or both. You could do the microneedling with the injections. And the benefit of that with the microneedling is that when we're microneedling, we're creating little puncture wounds into the skin. So it's a controlled trauma being done to the skin, and that's gonna stimulate collagen and elastin, but we're also infusing it with that PRP, and we're promoting healthy cell growth and cell turnover by doing so. And when we create trauma to the skin, it forces the skin to regenerate. And by adding the platelet-rich plasma, we're creating healthy skin growth that's going to correct problematic skin or skin that is undesirable or has been damaged in any way. So some examples of that would be if you had scarring, if you had any pigmentation, rough texture, fine lines. These are all forms of skin damage. PRP can be used for many different reasons all over your body. So if you have any surgical scars, you could microneedle PRP. Some people like to have it injected under the eye, in the nose to mouth lines, in any particular spot that's a little bit more problematic and we want to get more depth than microneedling. We might go in with a needle. Potentially, they're starting to see that there might be some benefits with stretch marks as well. But any crepey skin, uneven skin texture especially, that's where I find the best results. If someone just has bad skin texture or crepey skin or looser skin, it'll help kind of tighten things up, and you know that stimulation of collagen and elastin goes on for weeks beyond your treatment. And once you do your sessions, so it does require a few sessions depending on how problematic your skin is, you might be looking from 3 to 6 sessions approximately, and then you can do a maintenance session every year or so. And yeah, so it continues to stimulate collagen and elastin. And if you're doing your skincare at home, you're using your retinols, you're promoting cell turnover, that's gonna give you the best results. Another cosmetic indication for PRP is for hair loss. So a lot of men and women can get injections into their scalp, and that helps stimulate the hair to grow back out. Now, one thing to really note is that there needs to be a hair follicle present. It only stimulates hair growth. It doesn't create new hair growth. So whoever you go to can assess the area and make sure that a follicle is present. Now, with the hair loss, typically you do require a few sessions. I would recommend anywhere between 5 and 7 sessions to really get a good result, in combination with other treatments, whether you're putting some topicals or doing some UV therapy or different light therapies. It's gonna work better that way than if you just did PRP alone. Although I have seen some good results with PRP alone. So I hope you guys enjoyed this video. PRP is definitely a bit of an investment, but it is a great treatment for anti-aging and long-term skin health. Definitely a fan favorite, and people who get it done are usually really pleased with the results, including myself. So yeah, if you guys have any questions, I answer all questions in the comments. Leave one down below, and I'll see you guys in the next video. Bye.